And they checked me out, and they found the growth on my voice box. I couldn't talk. But then they said it was cancer, so I had to go up to UPMC to Dr. Ferris. But he had said if I would go through radiation and chemo, that it will dissolve and go away. But before I would do anything, I would have to have all my teeth pulled, because they wouldn't do anything because they don't want no infection in my mouth, let alone my throat. So I had to come back down to the Catholic Charity, and I went through them to have my teeth pulled. And then after that, I went through my chemo and my radiation from the middle of January till the middle of March. And I was pronounced cancer-free.
We have been called the Miracle on 9th Street, and I would say that is a perfect description of the Catholic Charities Free Healthcare Center. The miracle is not me, it's not the staff, it really is the volunteers who come here day in and day out with smiles on their faces, willing to do whatever it takes to serve those in need.
I say it every day, that the thought of that I know that if something happens to me, that there's someone out there that would care for me, and I wouldn't have any worries, I wouldn't have to put any strain or stress on my family. So this has absolutely been the best.
Many people would be surprised to learn that the patients that are part of the Catholic Charities Free Healthcare Center are individuals who, many of them, have held jobs all their lives, and now all of a sudden find themselves in a position where they have abruptly and acutely become unemployed. So they face the challenges of now understanding how to secure and gain an income that will cover their rent, that will cover food, that will keep clothing for themselves and for their family members, and pay their utilities. So what is often given up, or what is often not available, is health insurance. And when I say health insurance, that's both medical and dental insurance.
Practicing dentistry is practicing dentistry. It's using your talents and gifts that God's given you to provide service to those patients that come into your clinic or into your private office. The type of patient we see here, I might add, tends to be a lot more grateful than those patients you see and serve in the private sector. That's the difference that I see. The thankfulness and the joy that the patients share with us after treatment's completed.
One thing that's different here is we have more time. There's no way you can spend a half hour in private practice without somebody coming saying, you can't pay the bills that way.
They were very gracious, very attentive. I was very impressed with them. I even told the doctor, I said, I've never had so much attention like you have given me.
When they come into this wonderful, wonderful healthcare facility, they're able to get the very, very best of healthcare, and that makes for a better community, a better society. And that's what I'm all about. We believe this is our roots, this is our neighborhood and our communities, and this healthcare is so important to all of us.
To think that there are 70,000 people within a 10-mile radius of the city of Pittsburgh who don't have health care is sad. But what is joyful is to know how many people are willing to be here, to help, to reach out to folks, and to make sure that when they walk in the doors of the clinic, when they leave here feeling very special, feeling very much loved, feeling very much cared for.
I had to owe them my life, because with my infection being as bad as it was, I wouldn't be here if the infection had continued and gone through my blood system. So I owe them my life.
I would definitely have to say this is Miracle on 9th Street. They're wonderful people. They got wonderful nurses, doctors, everything. You couldn't ask for better.